It's not your fault that you have gestational diabetes. Being pregnant is the only time you can eat guilt-free. And then you get gestational diabetes. And it sucks not being able to eat whatever you want. I was in denial when I got diagnosed. And then, once the denial goes, I started to feel really guilty, like it was my fault. But I'm sure this happens to so many other women as well, but it's not our fault. It's our pregnancy hormones, it's our placenta, and it can't cope. If your parents have diabetes, you're probably at a very high risk of having gestational diabetes. And if you've got other health conditions like PCOS, you can have gestational diabetes in one pregnancy but not the other. There's a very short amount of time for you to get your diet and your lifestyle sorted. If you can't, over maybe a week or so, you will be moved up to the next step. The ranges that you have to keep your glucose levels in is very narrow, and you have to get it right. If you have a couple of raised readings every week, then they will put you onto the next step of treatment. The best trick for your diet: have a portion of protein, fiber, and complex carbs. As a vegetarian, I found it really hard to eat the right type of things. So my favourites were Greek yogurt, soya, tofu, beans. It's trial and error. Some things that work for others may not necessarily work for you. Be prepared for induction. Do your research. Just be informed about what you want to do. And if you have the pessary to start off your induction, just walk as much as you can. I think that really helped. They might try to scare you and say it's going to affect your baby, but there is a very small chance it can make your baby a little bit bigger. Maybe you'll most likely be fine, that you might be at higher risk of getting diabetes later on in life. However, if you maintain a good lifestyle, eat healthy and exercise, you are less likely to get diabetes.